Hello, everybody, and welcome to another session of dental shadowing. Today we have Dr. Muntean going to talk to us a little bit about her life as a general dentist. She's also a co-director of IgnitePredent, so that's awesome, and she's going to give us also an awesome session today. So, Dr. Muntean, you can go ahead and take it away.
Thank you so much for this opportunity. Super excited to spend the next hour with you all. And I have a lot to share, so I'm hoping that I'll get through it all and not go over the time. So bear with me. All right, so let's get started. So first of all, I have no financial affiliations with any of the products and companies that you'll see in the presentation. So just putting that out there. So who am I? I am actually originally from California. I went to USC, did my undergrad over there. So if you're watching and you're a Trojan, fight on. And I grew up in California. My parents are Romanian, and I speak Romanian, and I also speak French, and I'm currently trying to learn Portuguese. So super happy about that. And after I went to USC, I was, trying to move forward with going to dental school and whatnot. My dad is a dentist. That is a side-by-side when he graduated and when I graduated. So I wanted to follow into his footsteps. And I was accepted to go to LECOM School of Dental Medicine, which is in Bradenton, Florida. And that's what the school looks like literally every single day, except for around like 3 to 3:30 when you get a nice big thunderstorm. And then, it makes everything cool down after how humid it is, and you get a nice car wash, and then you go on with your day. So I was very, very thankful to go to that school. And I absolutely loved going to LECOM. I love seeing what it's, the improvements that it's had since then. And I'll talk a little bit more about it later, but I hope that you can see this picture. So that's one of my mentors, other than, of course, my dad. And this is David Rice, and he is the founder of IgnitePredent. Of Ignite DDS. And Ignite DDS is something that helps dental students and new dentists with a myriad of things, from practice management to tips and tricks for your courses that you're in or procedures that you're doing. Just how to speak to your patients, so many things. We are actually launching something called Ignite University right now that we've all been working super hard on, which is basically just a CE curriculum with so many things that will help with your time when you become a dentist, and you can even take advantage of it now. But I met him my first year of dental school, and I kind of shared with him my journey as a pre-dental student, and then we both decided to co-found IgnitePredent, and have absolutely loved participating in IgnitePredent, and really tried to build that to help pre-dental students like you all. And I've been able to give lectures around the country and share my story and help a lot of students with personal statements, interviews, and I just love getting all the texts and stuff saying, oh my God, I got into dental school and whatnot. So super happy to have started that. Let's see. So while I was in dental school, I did anything and everything possible to be the best I could be. And I became president of ASDA. And so ASDA stands for the American Student Dental Association. It's basically the baby of the American Dental Association. And when you are part of that, when you become president, you become the consultant for the Florida Dental Association, depends on which state you're in. And I had the honor of doing that, got to participate in a lot of organized dentistry. This was me at one of the conferences, got to travel around the country to different conferences and whatnot. And I got to speak on behalf of all of the dentists and dental students in the United States, in Florida, to fight against dental therapists and try to implement a program that would help with repaying loans instead of using the funds towards dental therapists. And due to the limit on time, I won't go into all of that, but if you do have any questions about it, please let me know. Then while in dental school, did research, and I was actually able to publish that research in Compendium, which is a pretty renowned dental journal. So that was also super exciting to be a part of. And because I'm a little bit crazy, I decided at the same time as dental school to do a master's. So I did a master's in health services administration. It was the last 2 years of the 4 years of dental school. So I did that at the same time. And it was something I chose to do because it helped me become more in tune with the financial business aspect of dentistry and running a clinic or an office, and understanding all the numbers and whatnot that I was going to face at some point. And so that's the reason that I did that one, and I'm very thankful that I did. So I got to get 2 diplomas that day and 2 hoods, and so that was super exciting to have that opportunity. At my graduation, because my dad's a dentist, I had the honor of having him hood me. So that was when he did that. So that's something for you all to look forward to if you do have someone in your immediate family who is in the health profession. And my mom is amazing, and she got this cake because it was also my 29th birthday at the same time that I graduated, and we had a little party at my dad's office. And so the cake was huge, and it was fun seeing like the oral surgeon and the endodontists and stuff like that that my dad works with, because they've all known me since I was a kid, and they were coming at the cake, and one was like, we need to put an implant here. One was like cutting it a certain way and saying we're doing an apico, and like it was just fun hanging out with them and seeing all of that. And after dental school, in case you don't know already, like you could go into private practice, or you can do a residency. That could be an AEGD. So an AEGD is an advanced education in general dentistry, and it's more clinic based. So you're based within a clinic, a school type of setting, sort of, or you can do a GPR, which is a general practice residency, and that's based more in a hospital. And so that's something where you're on call a lot and dealing with, people coming in with like, trauma and whatnot. And so you can do one of those 2 residencies, or you can go on to a specialty, or like I said, you can just, start practicing. And so I decided that I wanted to do an AEGD. I would highly recommend for anybody. I don't care how good you think you are when you get out of dental school. You have so much to learn, and you need to be very humble. And I highly recommend doing that and going into the residency. It's just a year of your life. I promise you'll survive. And so I did my AEGD at SIU. And then after that, so SIU is Southern Illinois University. And so I moved up here. And then after that, I applied to their implant fellowship, and I was accepted into the implant fellowship. My goal was always to do something, throughout my time of figuring out what I wanted to do, I knew that I wanted to do something with implants. And so that I wanted to get that experience and not just a weekend course. And I wanted to know that I could be more sure of myself when it came to dental implants, and be able to roll with the big dogs that are the specialists. This was during the implant fellowship, but this was actually during COVID. And so everything shut down because I was in the fellowship during that, and we started seeing all the the 5 of us started seeing the emergency patients for the entire school, and then that became open to the whole state of Illinois. And so it was a lot for the 5 of us, and that's my faculty or my implant fellowship director on the left over there. But yeah, I'm sure you could spot me on the tall one in the back. And that was quite the interesting thing, of being in dentistry at such a important time in our lives. Very stressful with all the masks and everything. And this is University Dental Care. This is currently where I work right now. And I have been there since August. So I've hit about 6 to 7 months now of working there, and things are going really well. And today's my day off. So I've been trying to run a bunch of errands around town and take care of everything. So tomorrow I'm fresh and ready to go again. So I put this here of one day you will thank yourself for never giving up, because as you can see, I did a lot of things. I wasn't saying all of them to brag about myself. I just wanted to share with you my experience and my journey, and maybe something, you can relate to as well, or maybe you didn't know about that you could do. But I say, you'll thank yourself for never giving up, because I actually applied to dental school 4 times. It took a big toll on me of, mental health and everything of, oh my gosh, am I going to get through this? And am I ever going to become a dentist? It's been my dream for so long. But I learned that everything happens for a reason at the time that it's supposed to. And I went through a lot of self growth and was able to learn a lot of things that I think made me be a better dental student, and then ultimately a better dentist. And literally every single day people ask me, they're like, are you old enough to be a dentist? So it's like, that's not, obviously that didn't impact me at all. Nobody's asking me like, oh, how long did it take you to get into dental school? Like, nobody cares. All you have to do is get in. So just a word of advice, if you're going through applying a first, second, third, whatever time, if it's something that you really want and something that you're driven to succeeding in, you'll make it, and you'll be very proud of yourself, because I'm super happy for what I've accomplished. So why dentistry? Here are, let me move this, hopefully you can see this. Here are a couple of cases that, oops, I did have it there. Here are a couple of cases and, just some stories that that really display why I wanted to become a dentist. And like I said, my dad is a dentist, and then my mom, who you see on the right, and that picture on the left is the office manager at his office. And I did not want to become a dentist just because my dad's a dentist. A lot of people assume that, that, oh, well, you have someone in the family, it was the easiest thing to do, or that somebody forced you to do it. And that's far from the truth. My parents always encouraged me to have a profession where I could take care of myself and I didn't have to worry about anybody else, and or be dependent on anybody else rather. And my dad always left the door open for dentistry. And ever since I was a kid, my father, I've never, ever, ever heard my father say, ugh, I have to go to work tomorrow. And for me, that was really important, because it just showed me, the beauty, one of the beauties of dentistry. And I started, going into the office, seeing it for myself. I saw that I really liked it, and I wanted to follow in his footsteps, and that's how that worked out. Another reason that I absolutely love dentistry is the fact that you could literally change someone's life or confidence in themselves in even just 10 minutes by fixing a tooth. And, it's amazing how you can do and make such a big impact on somebody. In the middle, you'll see this was a patient who was 10 years old at the time, and he had chipped his front tooth, and then he had a cavity forming on the lateral. And so that top picture is after I prepped and took out the cavity and everything. Chip, I didn't really play with much except creating a bevel, which basically a bevel is kind of like a sideways way of using the burr so that you create as much surface area for your material to bond to. And so his dad actually took these pictures, and I, fixed that tooth, those teeth, and he was just the happiest kid ever. And even his grandparents told me, thank you so much, because you just made such a big impact on his life, and his friends aren't calling him Chip anymore and stuff like that. So I love that aspect of dentistry, because you don't have to sit there for hours doing something to change, to someone's life and make it better. And then this lady that you see on your right, she came in, rheumatoid arthritis, 75 at the time, couldn't brush her teeth anymore because of, couldn't really hold a toothbrush much, and all the teeth were crumbling. And basically, this was my third year of dental school, and I extracted all of her teeth and I made her dentures. And I still keep in touch with her to this day. And she really impacted my journey and my path towards what I wanted to do in dentistry, because before I met her, I was pretty gung-ho on becoming an endodontist. So that's the root canal specialist. And when I worked on her, that was the first time that I really started extracting teeth. And a lot of my professors kind of saw that I had a gift, for lack of a better word, at extracting teeth and doing surgeries and whatnot. And so then they tried, getting me to become an oral surgeon, but I was like, oh my gosh, I don't know that I could handle another 4 to 6 years of school. And I started doing research on it to see, is this something that I'd be happy doing? And all in all, it's a longer story, but I realized that I love too many things about general dentistry to give up to become a specialist. And when it came to oral surgery, I just didn't really want to deal with, the on-call schedule, and dealing with someone who has a gunshot wound to the face and stuff like that, and having to put them all back together. It's just, even though you don't have to do that as an oral surgeon, you end up having to do that in your residency, and it's just something I just didn't really want to go through. And also, when it came to being a specialist, I like being a general dentist where I could still collaborate with somebody else, and when it comes to those harder cases, and see, is this something I should be doing? Do you have thoughts on this? And it's if I do have a patient that has, behavioral issues or something, I could still give them to the specialist. I'm not the end all be all, which is a nice aspect of being a general dentist. When it comes to the schools that I went to and I chose, like I said, I applied 4 different times to dental school, but I ended up I interviewed at multiple places my 4th time, and I had my interview at LECOM, and 2 weeks later they accepted me. And that was kind of an eye opener. And that was you know what, even though I never thought that I would leave California, I never thought that I would leave and go across the country. I learned that, again, everything happens for a reason at the time that it's supposed to. And I was meant to go there for some reason, and they accepted me for who I was. And it wasn't anything that had to do with my dad or whatever. It was all me. And so I could not be more thankful for going to LECOM. The school at the time, I was the 3rd graduating class from it. So now I think they're at the 6th or so. But yeah, it's a newer school, but I absolutely loved the fact that it was a newer school, because I got to help with making its reputation, and it wasn't stuck in its own ways, no offense or anything to any other schools, but, it's just one of the perks of, they want to hear from the students and see how they can make things better, because it hasn't been working for them for many, many years, and we're not going to change or something like that, So, and LECOM is constantly improving and making changes to be better and better. And so I personally loved that aspect of LECOM. And another awesome thing about LECOM is that there are no specialties at the school. So you get to do everything yourself. You don't have to give your case away to somebody else. Also, the third and fourth years are separate. So your first 3 years, you're in Bradenton, Florida, and your last year, half of the class goes to Defuniak Springs, Florida, which is in the Panhandle, and the other half goes to Erie, Pennsylvania. And they have 2 dental clinics built over there, and you're working over there, and basically you're doing a residency program over there. I did over 300 extractions while I was in dental school. A lot of students get maybe 20. I did over 300. I did over 300 again. Restorations. I did over 50 crown and bridge units. These are some really high numbers. And so because the third and the fourth years were separate, again, you didn't have to give up your cases to as a third year to a fourth year so that they could graduate. There were never issues with, fulfilling your requirements. I was done with my requirements both years by February, March. So those are just some of the aspects that I absolutely loved about LECOM. And if y'all ever have any questions, please let me know. More than happy to, talk about the school. And heck, it looks like that like I said, all the time. So not a bad deal. And then Southern Illinois University, the periodontist that worked at LECOM and still does, he told me about SIU and their AEGD program. And I really liked that their AEGD program taught the principles of Dr. Peter Dawson, who is a really big name in dentistry and occlusion. And my father did all of his courses when I was a kid. And then I got the opportunity to do one of his courses. I was and still am close to his family. And he unfortunately passed away in 2019. But I really liked that SIU went by his principles, because that's the way that I want to run my practice at some point. And I use things that I've learned even now and as an associate. And so that was really important to me. And then also the fact that they had the implant fellowship, I felt that my getting that experience of being at the school and everything, and then, them getting to know me getting to know them, and we can move forward with hopefully getting into that implant fellowship, which I was honored to get into, and very thankful for the opportunities and I've had there. And I was able to place 85 dental implants. Could have been more if it wasn't for good old COVID. But it is what it is. So, but all in all, make the right choice for you. And the key is just to get in. It does not matter where you get in. Even if you get into just one school, who cares? There's a reason you're supposed to be there, like I said. So please, whatever it is, don't think about other people's feelings and stuff like that. If you know that that's where you're going to be happy, go there and just get into dental school, because at the end of 4 years, you're going to have that DDS or DMD behind your name. Nobody's ever going to take that away from you unless you do something stupid. And then, also, like, nobody's ever going to ask you where you went to dental school. I mean, maybe like colleagues and stuff, but my patients, not once has anyone ever asked me, like, where did I go to dental school? Like I said, they usually ask me how old I am. So that's kind of, that's what I would say. In regards to extracurriculars, I did a lot of tutoring. So I would tutor students, and particularly in math, because that was always my thing. And so that helped me also not only with extracurricular activities, but also getting some money, so that, I never liked asking my parents for money. So I liked making my own. I shadowed at various offices. So I would shadow every Friday at an oral surgeon's office. I shadowed at an endo office, shadowed at my dad's. So really important to kind of see the different fields of dentistry. I was president of USC's Predental Honor Society. So that was me with my board at the time. And so that was in 2010. Oh my, that was 11 years ago. Oh boy. So yeah, I'm not old. So yeah, anyways, then I would highly encourage you to get involved in leadership, and it doesn't have to be in dentistry. That's something, please understand. Everyone thinks that, oh, I want to go into dental school, so everything has to be about dentistry. It does not. I mean, obviously choose a couple of things and definitely shadowing and whatnot. But, if you're super into art or something like that, like be in the art club, be a leader over there. You don't have to be a leader in a dental club. Then I didn't know about the American Student Dental Association at the time. I wasn't very familiar with it. And I wish I was as a pre-dental student, but I would highly recommend you becoming a part of the of ASDA as a pre-dental student. There's a lot of things that they have over there. So that's one thing I would recommend. And then research. Research will definitely put you apart from your peers and give you more to talk about in an interview and more to talk about on your application. So I would highly recommend get into some sort of research while you're in or before you go into dental school. And remember that research does not mean being like in a lab, dealing with mice or whatever and stuff like that. There's a lot of aspects of research, whether they be surveys, whether they and there's just so many things that you can do with that research entails. So really look into that and find something. Studying for the DAT, obviously I did that many, many years ago now. But because I've been involved with like a lot of pre-dental stuff, I still know a few things here and there. But the way that I basically ended up succeeding with the DAT, because I took it 3 times, the first 2 times I got the same score. 3rd time I finally did well, but I ended up getting a private tutor for that. And that's what worked out best for me. And because it's just how I work as a person. But you can use Kaplan. Barron's is they make everything a lot harder, which is good because you'd rather be exposed to something hard. Top Score also would give like practice exams that were a lot harder than the actual DAT. I know there's like DAT boot camp now and iPrep and stuff like that. So like I said, I'm not as familiar with this anymore, but I know Chad's videos is something that's really, really good for, especially for chemistry and organic chemistry. DAT Destroyer, Crack That PAT is another great one. There's something else, PAT Booster, I think it's called. They have great things to help you succeed in that. But basically, my main recommendation doesn't matter how old I am because this still applied for my board exams, is take a lot of practice tests. I cannot emphasize that more. And until I like went through it and saw for myself that, people were right in saying take these practice tests, I can't encourage you more. It does not matter how much you study. If you haven't taken those practice tests and sat through the exam and the timed yourself and seen the type of questions that they ask, you will not succeed. So please, please, please practice, practice, practice. All right, so general dentistry. How am I doing on time? Half an hour. Okay. So general dentistry, this is, a case I did. It could mean he was 17, 18 years old. It could mean doing regular restorations, your fillings. You do that every single day. You will be surprised of how many fillings people could have. And so you have to get really good at doing that. It could involve extractions. This was something I did right when I started my job. I had a patient came in, he needed his wisdom teeth extracted, and I never in a million years would have guessed that number 16 from that x-ray would have looked like that from the side. And then number 17, you can see that mesial root. Okay, now that I look at the x-ray, yeah, that looks pretty curved. But that one, again, no clue how I took that one out. I mean, I have my little techniques and stuff, but you know, you can be doing these types of extractions. I absolutely love extractions. It's awesome at my office now because one of my associates absolutely loves doing root canals, and I, oddly enough, don't care as much for doing. I mean, I'll do them, but if he wants to do them, you can do them. And then I'll give him root canals, he'll give me extractions, and then the owner doc, he does ortho. So it's like we're kind of like our own little specialty office without being specialists, because we all like our own little niche of things. And then I love doing implants, and so you know, that's my other surgical side. You can take patients from, you can see this before and after. This was a patient of mine during dental school. The student before me had taken out all of his teeth, but he needed some phrenectomies. And so I ended up doing a phrenectomy before I even did a filling or a cleaning on a patient. So phrenectomies, basically you have those strings of tissue that are in different places in your mouth. And for some people it hangs lower. And so like you have the one that's like under your lip over here, for instance. And so when it hangs in the wrong area, it won't let a denture, for instance, seat properly, and you'll constantly be flicking that denture out. And so we needed to do the surgery to snip away that extra tissue, and we did that for this patient. And I still to this day keep in touch with this patient, and it's just amazing to see those relationships that you make in dentistry. This was a tooth I took out, which was not just one tooth, it's two teeth. So this is called concrescence. So this is when teeth are fused at the cementum. And so I went to go take out number 15, and the gentleman was 80 at the time. And all of a sudden, like, you know, I elevated it out, everything was coming out nicely. And I'm like, oh my gosh, like I start taking the tooth out and to put it on the tray. And I'm like, this tooth is huge. And I started freaking out in my mind and sweating because I thought I took out his maxillary tuberosity, which basically, if God forbid he ever needs dentures one day, like, you know, that's something that you really need. And so it's a bit of bone that you have all the way in the back. And so I was like, oh my gosh, like he's 80 years old, he's never gonna heal. Like I was freaking out about this. And then as I'm like putting it down and like getting ready to like bear the bad news, I was like, why does that look like another crown of a tooth? And so his wisdom tooth was fused to the second molar. And so when I pulled them out, I pulled them both out. And so that's something that's very rare. But I still have that tooth to this day. It's somewhere in my like old dental school stuff. But yeah, super interesting. And a extraction I will never forget. And it was right after Labor Day. So I told him, I was like, it's a post Labor Day special. I'm not going to charge you. You got a 2-for-1. So yeah. So like I said, in dentistry, there's a myriad of things that you do. You see people with tremendous gum disease. You have to take out those teeth. You know, here, took out all of his teeth and sutured him up. That was the same day, obviously. And then eventually delivered a full upper and lower denture for him. And you get to change people's lives who are cancer survivors. And I had a student discount that I was able to give to her, and she needed crowns. And I gave her the smile that she always wanted. Here she was just in temporaries, and she again, like I said, I keep in touch with the patients a lot. And to this day, she texts me and she's like, I can't, thank you enough for what you did for me. It was the first time I actually did something for myself. And I mean, it's just amazing, those relationships that you create with with patients in general. And you can do really cool things like work on animals too. So this was an opportunity that I had with another dentist that his name's Dr. Geyer out in Florida. And he actually came to my graduation, and I saw him on a TV show, and I was like, well, he works at Busch Gardens, and like, that means he must practice here in Florida. And so here, there, whatever. And I reached out to him, and then I got to help him with working on Lana, the lesser bush baby, and Mikey, the red kangaroo. So that was awesome. And there's a lot of, oh, that's what happened to that. I was trying to figure out what happened to my video. Okay, so there's a lot of cool things in dentistry that help you do dentistry. One of them is an intraoral scanner, so you don't have to take those alginate impressions anymore. You can take digital impressions. This is actually my mouth. It's quite big. And so, but it's awesome because you can, have that technology to show the patients their teeth like that. And you can also take, you don't have to deal with someone gagging anymore. You don't have to deal with all the materials, pouring up models. You can just email that straight to the lab and be done with it. So you can take impressions of crowns that way, or prep teeth for crowns. I mean, it's just awesome what dentistry has become. And you can use it for implants. So this is called a scan body that you see on the left. And basically you put those scan bodies in the implants, and that's how you end up scanning it, and the lab will recognize how that implant is, what the emergence profile is, stuff like that. And then you can build a crown off of it. So this was a patient that I had during my fellowship. Number 30, as you can see, is pretty infected. It was too far gone for doing a retreat or anything from that root canal that you can see. It had class 3 mobility. Once a tooth has class 3 mobility, not only does it go from side to side, but it also goes up and down. And so pretty much you're not going to be able to save that tooth. And so there was a fracture between the roots as well. And so I did that surgery right when 2020 started. And she also had the foul odor. And so we fixed all of those problems. And that's how the tooth came out. That's how the implant got put in. We put in a special implant by Southern. It's called a Southern Pro Max. And basically it's a huge implant that's used for immediate placement. And I was able to scan that in, and you can see that scan body over there. And then you can see that was a healing abutment that we put over there to cover the space and keep the tissue in. And this is what it looked like. All of that filled up with bone and everything, with healthy bone on the left, on the distal of that implant. And you can just see what a big boy of an implant that is. And you'll learn about all of this at one point, but we were able to give her a nice restoration. Unfortunately, I didn't get to do that, but so I don't have any pictures for that part of it. But I know she's a happy camper now. Because shocker, I kept in touch with her too. And this was actually a case I just did a couple weeks ago. So this was my first case since my fellowship that I did all by myself. So that was super exciting. But basically a 64-year-old female, she had presented with a denture that she already had on the maxilla, and on the mandible, she had a couple of teeth that needed to go, lots of infection and whatnot. whatnot. So took all of those out, put bone in that area to preserve the site, let her heal for a couple of months. And then I went in and I put in the implants. In the meantime, I had made dentures for her that were brand new because she had some, a denture and a partial that were quite worn out. And so here was the surgery day. Very important to keep those as parallel as you can. And even though, again, technology has improved for you to be able to correct if you do deviate a little bit in how you put those implants. But anyways, place those implants, and she's super happy. Right now, we're just waiting for everything to heal. And then we'll hook those implants to the dentures. But I just saw her this past week and took a couple of x-rays of the implants, and they all look great. So yay. This is, okay, still good on time, sorry. So this is something that a case that I'm super proud of. Chrome is a method of doing full arch guided stability. So basically of gaining full arch guided stability. So basically you plan absolutely everything digital, and you are able to pretty much give the patient teeth in a day as long as everything in your implant placement is stable. So this patient presented, 71-year-old female, best chief concern I've read or I've seen in my entire life. I want to be able to chew a pork chop because now I can only chew a filet mignon. I mean, life's tough, you know? And so I completed this surgery in February of last year. And you can see this was after I placed the implants, but basically didn't have to do a sinus lift or anything like that because we did literally everything digitally. So this was the setup of everything, all the guides I needed to use. We had multi-unit abutments, which I'll show you some pictures of, and just a lot of things. You can see there was also, I don't know if this works, but over here you can see there's a denture just in case it didn't go the way that was planned. And so just to kind of run you through, this is what the operatory, how I set it all up beforehand with like all those papers that you see on the walls. You know, I didn't want anything to be messed up. But my assistant set up the instruments and everything. And I think this was at the end of it, looking at that, how empty that table is from the previous picture. But this is how it all started. Hopefully nobody's eating their dinner right now. So she had all of those teeth remaining on the top, which had to go. As you can see, there's some root tips in there. A lot of teeth had an infection or whatnot. And mind you, this is a case that in the real world will be about $25,000 per arch, just so you're aware of kind of what to expect. But I pushed all of her tissue back on the front. So that's what that one is. And I used what's called a pin guide. So basically this was used to make this silver part that you see at the top to seat it in the right place. And but this is again while those tissues are already retracted, and then you'll see these blue pins at the top. So those are super, super thin and they go straight through the bone and everything. So you're avoiding the nerves and stuff because you've planned it all before on the computer. So now we took off that grayish whitish looking thing that you saw in first. So now you see the base. So this silver base that you're seeing is what you keep stacking all of the different guides against so that you can fulfill what you want. And so over here, so now I was able to take out all of the teeth. So guide is still in place. You don't want to move that thing because that'll screw you over pretty much. And then this is the osteotomy guide. So basically you start making, you put this on and connect it to base, and then you start drilling your osteotomies. So an osteotomy basically is the hole that you're going to put that implant in. And so you drill with something thin, and then little by little you make it bigger to the size of the implant that you're going to be placing. And so that was the osteotomy guide, and you can see everything's in like different directions and stuff like that, because we're trying to avoid the sinus, and we're also putting them in certain directions so we can create stability for that, so that we can immediately place a hybrid on it. This was the prosthetic carrier. So this is what you see as the multi-unit abutments, and this is what you're basically going to use to connect the implants to the prosthesis. So the hybrid that you're going to be delivering temporarily in the patient's mouth. So we put these little gaskets over so that the material doesn't bleed everywhere and cause this all to get stuck. Here you can see the hybrid that's put over everything, and then basically around these multi-unit abutments, you're going to put a special material that is going to fill in all of those gaps, and then you just unscrew the thing completely out. This is from another view. This is after we sutured her up and we needed to clean up that prosthesis, and that's what the prosthesis looks like now. But this is, again, just a temporary one, and then she should be almost done now with getting the final one, but the next fellow took over that. So also we ended up afterwards, because she was too tired that day, so we waited a couple weeks, and then I took out number 31 over here, or 30, and then delivered a partial on the bottom, and this was immediately after delivery, and she was able to have a full set of teeth now. So here you can see the partial a little bit in here. It's a clear one, but yeah, so yeah, happy patient. So basically, I want you to remember the outcome of following your dreams. Do what you need to do to be successful, and you'll get these awesome diplomas. On the left, that's like half the size of me, and I'm 6'3", so that's a pretty big diploma for dental school. And on the right is my master's one. And a piece of advice that I want to leave you all with is surround yourself with people who are better than you, because they're always going to want to see you grow. They're always going to take you with them. If you just kind of hang out around the same people that don't have, strong goals, they don't have to all be wanting to go to dental school or something. But if you aren't with the right crowd, they're not going to let you succeed. And so really surround yourself with those awesome people. That's what I did. That's what I did in dental school. I can't say I really hung out with my classmates much, not because anything was wrong with them, God forbid, but I just wanted to surround myself with great people in dentistry that were accomplishing things that I knew I wanted to accomplish. Just like Dr. Rice, I wanted to always, be his mini-me. Dr. Dawson, and so many other people that I've gotten so many opportunities, and such awesome things have happened to me because of those relationships that I've been able to create, and I'm very thankful for. So if you want to contact me, there is my information. You can hit me up on Facebook, you can hit me up on my Instagram, whatever it may be. But I thank you all for your time. And if you have any questions, this is an awesome time to ask me them. And again, like I said, if there's anything I could ever help you with, please shoot me a message.
Thank you so much. We have some questions in the chat for you. The first question was, what do you use to fill the gap or hole in someone's tooth?
So, great question. So you're either going to use composite or you're going to use amalgam. That's basically the two big things. There's some other stuff like glass ionomer and whatnot, but usually you use that in layering, and there's a reason you're using it, and blah, blah, blah. But amalgam is your silver filling, and Composite is your white filling, okay? And what comes in a bunch of different shades so you can make everything blend as nicely as possible. Amalgam isn't really used as much anymore. A lot of people don't like those silver fillings. They want to get them out. There's the hype about mercury and whatnot. It's not anything. You're not going to get mercury poisoning by having silver fillings in your mouth. Amalgams are actually really good fillings in regards to if someone has a very high caries rate, meaning that they get cavities all the time. Amalgams are very good for helping the teeth not get recurrent caries, so that get a cavity again on the same tooth. But they're a lot less technique sensitive because you're just stuffing in that amalgam, for lack of a better term, as opposed to with composite fillings. You have to make sure there's no moisture anywhere. You have to layer it correctly. You have to cure it, and you can't cure too much. So it's very, very technique sensitive, but that's pretty much what a lot of people use nowadays. Like my dad, he hasn't placed an amalgam filling in over 20 years. So, and I don't plan on placing any. I mean, I placed them in dental school and that was it. So, yeah.
And then another question was, what do you recommend if you don't get into dental school right away? What could you do in the meantime as you try to apply for a second time?
Great question. So you can do one of three things. If the issue of you not getting into dental school is your grades. So one thing you can do is something that I did, where I took a lot of classes, particularly science classes, because OChem killed my GPA. And so I really wanted to raise that science GPA, but then I also took some business classes as well, so I could start getting into that. And so that's one thing that you can do. But make sure that you take them at 4-year accredited universities. Don't take them at a community college, because even though it's cheaper, it's not going to benefit you as much for that credibility of the school, knowing that you're going to be able to be a successful dental student. Another thing you can do is a post-bac program. And so there are a lot of programs that are specific towards, becoming a dental student. And so that actually helps you a lot with your first year of dental school, because you'll have taken a lot of similar courses and you're a lot more comfortable with them at that point. And then the third option that you can do is a master's program. And so I mean, in hindsight, I was kind of stubborn and I didn't want to take a master's or do a master's program for some other reasons. But if I do feel like maybe if I had done a master's program, I would have gotten into dental school sooner. But like I said, it is what it is. I learned a lot more otherwise, but those are things that I would do. Get into maybe dental assisting, and you might be able to get paid for that, and then it'll also help you. But make sure, not only, that's another piece of advice, not only if it's dental assisting or dental shadowing, but make sure that you're with a doctor that wants to teach you. I promise you, you're not going to see anything just hanging out over, looking over the dentist's shoulder. Like, I have to use my loupes to see anything. So how could I expect you, who's sitting, 2 feet behind me, to see something? And so you want to have someone teaching you what the heck they're doing, why they're doing it. I'm using etchants, to do this, and then I'm using bonding to do this, and this is, the trick that I would do for this. And so that's the only way you're going to learn, and you're going to continue to fall in love with the profession.
And then another question was about your master's. I know that we've talked about master in public health, but you're a different type of master of health and services administration, right? So can you talk a little bit about the benefits of that, or like the process?
Yeah. So my school just didn't offer a master's in public health. So I would have done that instead of the Health Services Administration. But it just didn't offer it. And they did offer the MHSA as a dual degree program. And so I was also able to get a discount because I was doing it at the same time as being in dental school. So in regards to, I would say it was more, instead of like, if I was trying to compare and contrast whatever to public health, I would say that for my MHSA, it was more business oriented. And so that's, why I chose that one and went through with it. And yeah. I don't really have much more to say than that, because it was just a great program for understanding the business aspect of things.
And then there's another question that talks a little bit about LECOM and how you mentioned there's not really specialties there, how you can specialize. So like, how was it during dental school, like working with or like doing different specialty like rotations and things like that?
So we didn't really have rotations. We did have rotations for like pediatrics. So it's not like kids were running everywhere or something. Because the way that LECOM is set up is gorgeous, and there's 10 different pods throughout half of the school, and that's in those 10 pods there's 10 operatories, and so everyone has their own operatory. You're never like fighting for someone with someone for a spot. And then each pod has its own wet lab, and it has its own secretary and stuff, and it's called a patient care coordinator in front of it. So it's really run like a dental office, and you get to learn how you're in charge of being in charge of sterilizing and understanding scheduling and whatnot. So when it came to specialties, we had different specialists that work at the school. And like, if we knew that we were going to do a procedure that day that involved a root canal, then we would tell that specialist ahead of time, and they would be there to oversee us when that happened. So yeah, that's how that one worked.
And then another question was, what are your goals for the future now that you are a dentist, whether that be practice ownership, specializing, etc.?
So definitely, at this time, I've done all the schooling that I think that I want to do. So like I said, I don't want to be a specialist right now. Who knows? I could change my mind. I do that a lot. But, I've gone through doing the residency, doing the implant fellowship so that I could be, what I've heard as a term is super dentist, and do the things that I want to do and be really good at them. And other things I want to do in the future, I'd love to lecture about implants, which was another reason why I did the implant fellowship. So I have that credibility that I do know what I'm talking about, and I'm not someone who took a weekend course. No offense to anyone who has, but I just sleep better at night knowing that I went through what I went through to be successful. And it was great in the fellowship because you see when things go wrong and what you're supposed to do, because it's not all rainbows and unicorns for everything. So in regards to practice and stuff, I still trying to figure out where I really want to be established. Right now I live in Illinois, but I work in St. Louis, Missouri, and it's about a 35-minute drive. And so right now I'm very happy being an associate. Knowing me, I'd probably want to have my own practice at some point, just because I like things the way I want them. And so I'd like to have that opportunity to decorate my office the way I do, to run things the way that I want. So a lot of people ask me if I'm going to go back to California because my dad's over there and I could take his practice. But at this time, I'm just not sure about that. And I really, really enjoy having 4 seasons over here in St. Louis. That's something that I never had the opportunity to have. And until you've actually experienced it, you won't understand me. So yeah, that's kind of where my head's at.
And then another question was, how can we get involved with the organization that you're a co-director of, IgnitePredent, and can you tell us a little bit about it?
Sure. So these are all really good questions, by the way. So with IgnitePredent, right now the focus has been more with Ignite DDS. And so if there is anything, just shoot me an email. And like I said, I can put you in touch with the right people. But with Ignite Predent, like I said, we do some personal statement reviews, mock interviews. If you ever want me to speak for your organization, I'm more than happy to help out with that. But like I said, the main focus right now is more with Ignite DDS, and you can still be a pre-dental student with that and get involved. And Ignite DDS is more of an organization for dental students and new dentists to really become the best that they could be. And if you just look up, go to ignitedds.com. You can start checking out all of our awesome things that we have over there. Follow us on Facebook and Instagram, and you'll see all the different opportunities we have, and just shoot us a message to see how you can get involved.
Awesome. And then our last question for you is, what is your favorite procedure to perform?
So funny, I was having a conversation with someone about this. I don't know if I would say I don't know that I could choose 3, or I mean, my favorite procedure. I would say, like, if I could do something the rest of my life, like only 3 things in dentistry, I would probably say I would do anterior composites. So, like someone has a chipped tooth, whatever, and you're just like free forming it. I would do extractions and I would place implants. So that's those. If I could just do those 3 things, I'd be a happy camper.
Awesome. Well, thank you so much, Dr. Muntean. Guys, the post-session quiz link is in the chat, and it'll also be in our link tree. You guys can go ahead and thank Dr. Muntean in the chat for this awesome session. But yeah, thank you so much, Doctor.
You're welcome. And like I said, I look forward to hearing from any of you if I can help with anything. And thanks so much again for this opportunity. It's awesome that you're doing this.